Well, welcome everybody to this public session of the NHS board, and we should just note that in line with government guidance, we're not having a meeting altogether with members of the public for this session. So apologies for absence. Susan Kilsby and Munir Per Mohammed have sent in their apologies, and Patrick Carter, his connection has been lost over the last hour, but he may or may not join later on. Most important, this is Amanda's first public board meeting as Chief Executive, and on behalf of everybody, I know all the members of the board, Amanda, many congratulations, well done, and we all look forward to working with you. Any direct declarations of interest that are not already recorded? Nope. And can I approve the minutes of the last meeting? Good, thank you very much. And so the first item, it's the Chief Executive's update. Over to you, Amanda. Deathly silence. Are you there, Amanda?
Oh, hello, apologies. I had muted my speakers inadvertently.
Okay, far away.
Well, thank you very much indeed, David. So I'm absolutely delighted to be addressing my first board meeting as Chief Executive of NHS England. And I would just like to start by thanking you and indeed the rest of the board for your support and counsel in these first weeks. It's been a summer, I think, of unprecedented pressure, but also of real achievement. Among the other advances, we've started the world's largest trial of the revolutionary new NHS Gallieri blood test that can detect more than 50 types of cancer before symptoms appear. We've agreed a first in Europe access deal for a revolutionary new treatment for certain types of lung cancer. We've announced the rollout of heart checks in community pharmacies, cholesterol busting jabs and genetic testing for a rare form of diabetes. And of course, we've also launched the next phase of the COVID vaccination programme with our teams now in schools and delivering booster doses for those who are eligible. In fact, today we've had confirmation that the NHS COVID vaccination programme has prevented more than 127,000 deaths and helped avoid more than 261,000 hospital admissions. I'm sure the board would want to join me in thanking everyone who works in the NHS who's been involved in delivering these improvements, but also, of course, thanking everyone dealing with the very tough day-to-day pressures we are still facing. Those teams, despite the pressure, have been able to make excellent progress on restoring services which were inevitably impacted by COVID. In the first 4 months of the year, and I know we're going to talk more about this, but it's just worth saying, we did see 5 million people start elective treatment, achieving 90% of pre-pandemic levels. In the first 4 months of the year, we also did 7.5 million key diagnostic tests, which is back over 95% of pre-pandemic levels. And we had 870,000 urgent cancer checks, more than the same period in 2019. GPs and their teams have delivered over 124 million routine appointments between April and August, more than the same period in 2019. And at the same time, let's not forget, they have also delivered the majority of our vaccination appointments. So I think this progress does provide a really strong foundation for continued action in all of those areas. And indeed, the welcome clarity that we now have on funding for the second half of the financial year means that over the last couple of weeks, we have been speaking to local leaders to update them on plans and priorities for the next 6 months. Our planning guidance does set this out in full, but I did want to focus, if I may, on 3 areas which I know are front of mind for our patients. So on elective care, our focus will be on continuing to achieve the maximum possible level of activity, but prioritising particularly those who, of course, are the most urgent patients, as well as those who have waited the longest. £1.5 billion is being made available to help local teams increase their capacity and invest in other proven measures to achieve these goals, like surgical hubs for high volume work. We also now have clarity on updated infection prevention and control guidance from government, and we're going to be working with providers to help them apply those new guidelines. Secondly, on cancer services, Our focus will be on meeting the faster diagnosis standard. That's 28 days from GP referral to diagnosis, or indeed, of course, ruling out cancer, and as well improving performance on 62-day treatment standard. On primary care, we're going to be making further targeted investment available to ensure GP practices are able to offer timely appointment options for those who need them, and that of course will need to include respecting patient preferences for face-to-face care, but also recognising that for many digital access, telephone access is more convenient. We also need to continue to increase the role of community pharmacies so patients can access consultations and treatments for minor illnesses and get support with their new prescriptions after being in hospital. Look, it's no secret that the direct and indirect effects of the pandemic continue to place a huge strain on both our physical capacity and our staff. The conversations we've had with local leaders over the past few weeks have really highlighted that it's not just volume of people who now need urgent care that's putting some of the pressure on the system, but it really is about acuity as well. Again, I know we're going to talk more about this, but just worth giving a few headlines. The numbers, I think, are quite revealing here. So, we currently still have over 5,000 inpatients with COVID in our hospitals. That is up from less than 800 back in May and around 600 this time last year. In the first 5 months of this financial year, teams have dealt with over 10 million A&E attendances and 3.9 million ambulance incidents. But within those numbers, that includes 100,000 more attendances at type 1 A&Es, so the most unwell, sickest patients than the same period in 2019, and a higher proportion of category 1 and 2 ambulance incidents. So it has been an incredibly tough few months, and it's worth remembering that it is only September. So even accounting for the vaccine effect, without which things would be much worse, and that's clear if you look at the PHE analysis I shared a moment ago, look, we can and we should reasonably assume things will get even tougher over winter. So alongside that progress on elective and cancer and investment in primary care, the planning guidance also asks local teams to prioritise continuing to deliver the flu and COVID vaccination programmes, reducing the number and duration of ambulance handover delays, eliminating 12-hour waits in A&E, rolling out community crisis response teams to every part of the country, and ensuring that patients can return home as soon as it's safe for them to do so. It is going to be really important we deliver on these priorities and do everything we can to deliver the maximum possible benefit for patients from the additional funding that they, of course, as taxpayers, are providing. I know people know this, but worth just saying, it is worth remembering we are one of the most efficient health services in the world, but of course we do need to continue to optimise how we provide care. And this really does include, I think, at its heart, making the best possible use, if you like, of our most important asset, and that's our staff. So that means continuing to make it clear that it is our diversity that is our strength, and that has always been the case for the NHS. It remains so now. It also means that we need to make absolutely clear that the investment in health and well-being needs to continue over the course of this year and indeed beyond. And what that means in particular is making sure that we are supporting and encouraging people to have their annual flu jabs. And of course, this year, COVID boosters too, because that's something that people can definitely do to protect themselves and their colleagues. And whilst I know many organisations are really well advanced in delivering both flu and COVID boosters, I would really want to just say to anybody who's listening, please do take up that offer as soon as you can. I'm sure that the board and the public would also join me in condemning violence and abuse against NHS staff. There's been recently a high-profile incident at a GP practice, but we do know that this kind of behaviour is suffered day in, day out by colleagues working in every part of the health service. Violence and threatening behaviour are never okay, but particularly so when it's against people who come to work to help others. I hope that people feel that they do have the tools they need to tackle this, and we really would encourage people to report incidences to the police, and they have been securing literally hundreds of convictions a month under the new legislation. But really want to make, I think, a plea to people just to look after and continue to support our NHS staff, because we know that is something that means a great deal to the people who are working within the NHS, but we have to take clear action if that's not the case. Finally, if I could just say, this meeting does fall just under a year on from the NHS's world-leading commitment to reach net zero by 2045, and of course just weeks before the world comes together in Glasgow for COP26. It's a massive achievement to be able to say that the NHS is on track to deliver its planned cut in emissions this financial year. The emissions reduction this year alone will be equivalent to that of 1.1 million homes. So returning to the efficiency theme, of course, energy saving is also money saving, both now and in the long run. And we're not just talking about the cost of monthly energy bills, though the current volatility in energy markets does show how using less and using renewable energy does build resilience. But it is the health impact too. The effects of poor air quality and climate change are already being seen in our GP practices, in our hospitals, and unfortunately in our mortuaries too. So whether it's extreme heat waves or air pollution causing asthma, heart disease, lung cancer, there's no doubt that this is a long-term problem for the NHS, and it's absolutely right that we are part of the solution. But we can't do this alone, and that's why it's so important that we throw down the gauntlet today to our suppliers as well. By wielding the massive influence the NHS has as a buyer of goods and services, we're determined not just to get a better deal for taxpayers, but a better deal for our environment and our future generations too. Delivering on these commitments and many others during the most difficult time in our organisation's history has only been possible because of our staff and the many thousands of volunteers and others who continue to support them. Colleagues, I know you know this, it has been tough, but there are also tough times ahead. So I will just end, if I may, my update by saying thank you once again to every single person who has worked for, who has supported the NHS over the last couple of years, and thank them again for the way they are rising to the challenges we now face.
Amanda, thank you very much for that. It was a wonderful introduction. I wonder if I could just pick you up on one issue, and maybe Andrew Morris would like to come in this. The absolute central importance of our workforce, a hugely diverse workforce, and how supportive we're being to everybody who works in the NHS. And Andrew, I know you've got some strong feelings on this.
Thank you, David. I mean, the NHS employs 1.4 million people. We want to retain as many people as we can going into the winter and for the future. Our plans are all predicated on filling the establishment to the maximum in order to ensure recovery. So EDI, Equality, Diversity and Inclusion, is an agenda that's really important to the work of the People Committee. It's central to being a good employer, and the initiatives that we're rolling out have improved retention rates quite markedly. And I know Prerna has got a further series of measures that we'll be implementing over the coming months. So it's a central plank of the work we're doing, and I totally endorse the actions we've taken so far.
Thanks, Andrew. And Mike, I know in the company that you used to run at Sainsbury's that you put these issues at absolutely the front of what you did there.
Yes, I think in any modern front-facing organisation, and particularly a big organisation like the NHS, is absolutely critical for any number of reasons. And Andrew's already alluded to some of those, whether it increases the talent pool from which you're drawing, it allows you to have a diversity of perspective, increases the diversity of skills that you can attract. To your employees, it shows that you trust and you care, or that you should be trusted and you care. And perhaps above and beyond anything else, it actually mirrors the people that you serve, because we live in a very ethnically and diverse and inclusive community. So again, I just reinforce Andrew's point that the board is wholly behind the EDI initiative that the team is driving through the organisation.
Thanks, Mike. So both to Amanda and to Prerna, keep up the good work. At the beginning of your introduction, Amanda, you drew attention to the Gallieri Grail cancer test. You referred to the vaccination program and the cholesterol lowering injections that we're now introducing into the NHS. I just wondering if Ara can hear me all right, whether you've noticed a sort of coming together of the life science industry and healthcare systems to improve healthcare. So Ara is, I think, temporarily dropped off the call. Anyway, Amanda, I think you see the life sciences industry as playing a very big, important part of how we deliver healthcare in the future.
Yes, I think the last 2 years, as we've responded to COVID, has really shown what can be done when we work in close partnership. So that bench to bedside timescale can be compressed, as we know, down to not just years to months to days. And I think what's been great is to see that energy continue over the summer with these fantastic initiatives that we've been able to launch. And just a huge thank you again to everybody who's been involved, because these are the life-saving interventions that we are going to want to see more of in the future as well.
And Amanda, look, you've been in the health service for, I won't embarrass you by saying how many years, but you've worked at Chelsea and Westminster and Guy's and Thomas's. How, so you've seen what it's like to be in a very pressurized acute hospital environment. How pressurized do you feel the system is at the moment?
So I think we have, and honestly, the numbers tell the story on this, but we've just had the toughest summer the NHS has ever had, coming off the back of the toughest 18 months the NHS has ever had responding to COVID. And we've got I think we've got to be very realistic, as I've just said, about what the winter is likely to bring. But the thing that has really struck me, David, is the level of commitment and energy and determination across particularly the leadership community in the NHS, because my sense, and I ask my executive colleagues their views as well, is that there is a real determination from colleagues across the whole NHS to say, you know what, the last 18 months have shown what the NHS can achieve. It's risen to the challenge over and over and over again, and therefore there is a can do. We've proved we can do it, and this next challenge is going to be about being deeply realistic about the scale of the challenge, but also deeply committed and determined to continuing to tackle it in exactly the same level of determination, professionalism, that care for each other, care for patients that's been shown over the last 18 months.
And maybe one last question. I mean, with Tim Ferriss joining the team now, I mean, you've been in the NHS for a couple of months. Your background's always been in the American care system. I mean, how do you see, what are your first impressions having been over here now for 2 months, Tim?
David, that's a terrific question, and thank you for the opportunity. I'll just say, I spent my entire career at Mass General Hospital in Boston and felt very fortunate to work in an organization with intense pride for the organization and one's colleagues. And I feel incredibly fortunate. I have landed in a place that has just that intensity of pride in the work and in one's colleagues. That is an extraordinary force for the NHS and will bring us through a lot in the future. All these pressures that Amanda is talking about by working together. I'll also say the NHS is an extraordinary place for innovation, and I mean, every time I've been now out to, I've had 12 trust visits, several practice visits, and I'm looking forward to many, many more. Every single place I have gone, there have been demonstrations of extraordinary innovation, really cutting edge innovation in better ways to deliver care. The challenge for us is not the energy and ideas around innovation. The challenge is spreading them at scale and pace. And I just want to say to you, David, that Amanda and the rest of the senior management team are really committed to doing that, to making sure that where those improvements are, so that we continue to reinforce the idea that doing your job and working to improve your job are going to bring benefits not just to you and your patch, but to the whole system. And I'm really proud and very pleased to be here, and want to thank you and Amanda and the board for inviting me.
Thanks, Tim. Look, so maybe for the next public meeting that we have, we could put innovation as a separate item on the agenda and just showcase some of the actually really remarkable innovations that are going on in the NHS. So we'll put you up to do that, Tim. Good. Well, Amanda, thank you very much for that. I mean, you've made a great start, and we're fully behind you. Look forward to working with you as we go forward. So thank you. And now we are moving on to Mark Cubban, who's going to run us through the operational performance. And Mark, I should say, is our interim Chief Operating Officer and was previously Chief Executive at Portsmouth Hospital. Mark.
Chair, thank you very much. I'm going to briefly just introduce the performance report and then hand over to colleagues who will talk through and give particular attention to specific highlights within the report. Amanda talked earlier about the context within which our staff right across the service are responding day to day to the pandemic, the current levels of the pandemic, and indeed restoring services as quickly as possible for our patients. At the moment, we have about 5,000 patients who are in our beds. With COVID, that number changes from day to day according to the level of prevalence that we see in our community. We are seeing slightly more patients who require access to critical care. So critical care has remained under continued pressure over the past 18 months. But our teams are working tremendously to deal with that pressure and to balance the demands placed on their services. We're continuing to respond and to coordinate the response as a level 3 incident, and that means that our regional teams are taking the lead, working with systems, working with organisations to provide the right coordinated effort to respond to the day-to-day challenges and to support the recovery and restoration of our services. And of course, in continued focus and real attention to infection prevention and control measures are ensuring that we can continue to provide safe care to patients across our organisations. I'm going to now hand over to Pauline, who will talk through UEC and elective care and touch on winter planning. And I'm happy to come back to talk through some other aspects of the performance report thereafter. Thank you, Chair.
Thank you, Mark. So, David, I don't want to repeat anything that Amanda said in her very comprehensive account, but I'll just highlight 1 or 2 points. And I think people have sight of the paper as well, and so the detail is in there. I'll start off with just saying a little bit about UEC. And first, I feel I absolutely must acknowledge the wonderful work that our staff have continued to do day in, day out, but also to acknowledge the fact that things have not always been easy for our patients during the summer period, as the service struggled a bit more than it does normally at that time of the year. So basically what happened over July, August and September was demand returned to a level similar to what we saw in 2019-20, but at the same time we had capacity constraints because of what Amanda and Marcus referred to on the back of our COVID numbers. So with having about 6,000 patients in beds, having to deal with the IPC, the very necessary IPC measures, and because of staff availability, and clearly some of that was down to the fact that our staff really did need to have some holiday period during those months, that there was very clear capacity issues. I think we saw that most of all in the ambulance service, where the 999 service received more calls than it had ever done previously, and 111 calls were up by 39%. So quite a significant hike in demand in both of those areas. But just on the ambulance service alone, to acknowledge that because of the great work of staff, the actual conveyancing numbers to our emergency departments were actually less than we saw during the same period in 1920. So what we're doing, and it's set out in the papers, is implementing a comprehensive recovery plan for UEC and the ambulance service, and that'll be a fundamental part of the winter plan. On elective, again, to acknowledge the work that's been done, Amanda referred to it earlier, that activity returned to about 90% in July, so that's 90% of what we were doing in 2019-20. At the same time, services throughout the country are building their plans for how we provide care to people who have been waiting the longest. Clearly, our first priority is always going to be our P1 and P2 patients, our urgent patients, but we want to have a real focus, as Amanda mentioned, to patients who've been waiting for more than 2 years, or indeed for anybody who's been waiting for over 52 weeks as well. So comprehensive plans being drawn up to be implemented for the rest of the year. At the same time, in order to maximise activity, a real focus on transformation, and a number of things highlighted in the report, greater use of IS, the accelerators paving the way for how we use transformation to increase activity, the high volume, low complexity work, outpatient work, the 17 early diagnostic units, and a lot of work on the back of the clinically based, evidence-based interventions. So those things are highlighted in the report. Thank you.
Thanks, Pauline. Before we open it up for questions, I wonder whether Keith Willett, so I can see there, who's running the our vaccination programme now, would like to come in.
Yes, thank you, David. And perhaps I could just give a short overview of the programme as it stands and the current context, and then a little bit out of the operational complexity that we now have to deal with. So first of all, a big thank you to everybody who works within the programme and who indeed has come forward to take advantage of it. The programme continues to make strong progress, delivering over 77 million vaccinations to date. That's over 40 million first doses and 37 million second doses. And for the most at risk, that's the Joint Committee on Vaccination Immunisation cohorts 1 to 9. That's over 90% have received a vaccination. And for the clinically extremely vulnerable adults, we're now at 94.6%. That's quite remarkable as a nation. And in line with the guidance from JCVI, everyone aged over 16 is now able to book their doses on the National Booking Service, in addition to receiving invitations from their general practice, choosing a community pharmacy, or finding an online walk-in centre. People will also be aware that on the 13th of September, the UK Chief Medical Officers advised that all children aged 12 to 15 will be offered 1 dose of the Pfizer-BioNTech COVID jab. And all that I've said there, I just need to acknowledge at this point the increasing complexity of our vaccination programme, with now multiple different cohorts of citizens to be invited, different vaccine types, different dosing schedules, and indeed now 4 delivery models. So a real thank you to the staff that are involved. And in terms of the operational complexity, we continue to provide the Evergreen offer. That's for those who have been eligible for a vaccine from the phase 1 and phase 2 of the programme, but have yet to come forward. They're still very welcome to come forward, and that Evergreen offer at those sites is still open. The NHS is now, as people will be aware, just started to support the vaccination rollout of the adult booster programme. That commenced on the 16th of September with the first jab being administered to a maternity support worker in Croydon, and that was in 48 hours of the JCVI guidance being published. People will be invited when they become eligible, and importantly, JCVI advised that the booster jab should be no earlier than 6 months after the second dose. That's when it will be most effective. So the hospitals are already offering booster vaccinations to their own staff. And important for the NHS and our wider care, The National Booking Service is also now open to eligible health and social care workers to ensure convenient and timely access for those working in care homes, domiciliary care, as well as in primary care, general practice and dental teams. The JCVI also published guidance on a third primary course vaccine dose for those individuals with suppressed immunity. And we started that vaccination programme on the 13th of September. Delivery of that third dose is reliant on hospital specialists and GPs to identify those eligible and to determine with the patient the best time in line with their treatment regime to receive that dose. As I mentioned earlier, the vaccination programme is now open to all 12 to 15-year-olds, and that's underway, and it's being delivered primarily through our school-age immunisation services, and that commenced last week. That's a new delivery model for the programme, and we're following that progress carefully. In addition, there was already present the at-risk programme for the 12 to 15-year-olds who are mainly being treated through primary care networks, where those children are very well known. And then finally, we are working still to increase the uptake amongst our 16 and 17-year-olds. Over 1,000 sites are now online for the NHS walk-in option, and we're looking to improve the uptake in that group, which we know are particularly vulnerable. Thank you, David.
Thanks, Keith. And look, on behalf of us all, Keith, thanks very much for stepping up and taking responsibility for the COVID programme after Emily sort of moved on. You know, that was a really tough thing to do. But so, you know, I know it's taken, 7 days a week, 24. It's been 24/7. So thank you very much. I wonder whether I come to Steve. Just Steve, if you're looking forward over the winter, just get your view on where you think COVID and flu is going to take us through the next 6 months.
Yes, thanks, David. So as I think Amanda pointed out, we still have significant numbers, around 5,000 patients in our hospital beds with COVID. Actually, that is down over the course of September. I think we will be exiting September with about 20% less patients in our beds than we entered in the beginning of September. So we're now back towards end of July, early August time. So of course that is good news, because that is beds that are then largely available, not completely available because of the complexities of keeping COVID and non-COVID patients apart, but are becoming more available to ease some of the capacity pressures that we have seen. And of course it's great news, of course, for everybody who's at risk of COVID. And that reflected infection rates have been falling a bit in the communities, but we have seen infection rates in children start to rise as schools have gone back. That occurred in Scotland a bit earlier. Schools in Scotland go back in the middle of August, although rates in Scotland have now started to come down. So I think it's an uncertain period, and at this stage in the epidemic, I think our epidemiological colleagues would say it's quite hard to model what the next few months will look like. And of course, the modelling that was done in the summer, actually the course of the pandemic has been at the optimistic end of that, but that means that there's quite a wide range of possibilities. All the more important then to keep the vaccine programme going at pace and scale, as Keith has described, because those booster doses in particular, but also the 12 to 15-year-old doses are going to be important going forward in keeping infections under control, and of course, particularly in the boosters, ensuring that any waning immunity that is going to occur, because that is the nature of vaccination, is counted in a timely way. So I will add my call to everybody to get the vaccine booster when you're at that 6 month point after your second dose, and you call for it. That's going to be critical going in. And then of course flu, we didn't see much flu last year, although we did have a fantastic flu vaccine programme last year, which was the best ever. But this year it needs to be better even again, because again there is uncertainty around flu. I think we are concerned clearly that flu, not having been around much last winter, will come back at a higher level. So we're already keeping a watchful eye on that. And then other respiratory infections such as RSV, which is an infection that predominantly affects younger children but can affect all ages. We've seen some unseasonable spikes in that over the summer because everything is so out of kilter because of the unusual 18 months we've had. So another close eye on that. And then, of course, we're seeing people coming back who have delayed seeking healthcare. and are now coming forward both to our elective services and to, in some cases, unfortunately, to our urgent emergency services. So it's not a normal winter. It won't be a normal winter. There's a range of uncertainty there, and all the more reason for the planning that Pauline has described, and for the work that Keith and others are doing, so that we can ensure the public is as protected as possible as we go into the winter months.
Thanks, Steve. So Andrew, then Amanda.
Thanks, David. Can I ask Keith if JVCI pronounced whether you can do a flu jab and a booster jab simultaneously? Because I'm just thinking about, you know, the immense workload that your team is undertaking, and clearly some clarity on this would enormously help.
Andrew, thank you. Yes, the answer is yes, you can. And we have promoted that where it is convenient for the individual, the patient, where it's convenient and efficient for the system. But what I'd also say, equally important, is that we're co-promoting it. So if someone turns up for one vaccination, as Steve says, we very much raise the profile, well, why don't you have the other one as well? But also an important aspect is where the programs are sequenced in some way for a variety of reasons, it's important that you don't wait for one until the other one is available. So if you're offered flu, take it now, and when your COVID turn comes, take the COVID then. Don't wait to hold the two together, because we don't quite know what the transmission is going to be and the winter looks like.
Thanks, Keith. Amanda, then Wal.
Thank you, David. I just because I just wanted to make sure we called it out, and I know we've covered a whole load of stuff already, but in the report, I think Mark has particularly picked up some of the data on where we are with mental health services. And I think it would just be, I just wanted to say, I think, number one, to acknowledge that the pressures that we're seeing on all parts of the system are no different in mental health. In fact, in some parts of our mental health services, particularly children and young people, they are under even more acute pressure actually than some other parts of the system. But secondly, just to say how important I think it remains that we continue to have our commitment to the long-term plan goals around mental health services. And I spent yesterday in Bradford visiting school, visiting various different parts of the system. And one of the things that came across so strongly from that visit was also just how important it is that is provided in that integrated partnership way. So the Act as One work in Bradford brings together in a local community, voluntary sector, schools, health professionals, health volunteers, and they really genuinely do act as one around the services they're providing, with a particular lens on reducing inequalities. So for me, it was just a really important thing to highlight in this conversation, that A, we recognise that there's real pressure on mental health services. B, that long-term plan commitment remains, fundamentally important. And C, we are seeing, again, it's Tim's point earlier, some just brilliant examples of innovation, partnership working all across the country. And certainly that is as true in mental health as anywhere else, and just deserves, I think, acknowledging.
I'm really glad you said that, Amanda. Mental health is so important. Well, then Ruth.
Thank you, David. Just a quick question on the vaccinations. Keith, you gave an excellent articulation of what's going on and the complexity. I'm wondering, given the lessons we learned earlier on about getting to hard to reach communities and thinking about the extra work then do on the booster program, because this isn't so much, when they arrive, giving them both flu and the COVID vaccine, it's more getting them there in the first place and ensuring we at pace get to a point where, when the high 80s, 70s, 80s, 90s, if you like, and then really focus on that, particularly the ethnically diverse, the issues we had around non-health seeking behaviour by some communities. What are we going to do about that, please?
Yes, thank you. Well, we've learned an awful lot, haven't we, about inequalities, deprivation, what I call the failing to reach groups rather than the hard to reach, because it's our failure, if you like, that we haven't connected. And the more and more we understand, the more complex it gets and the more local and specific it becomes. Working through local communities what we're calling the hyper-local focus is absolutely critical, and that's right down to making sure that the people who are talking about the vaccination and promoting it are from that group, that they are the faith leaders, they are the local community leaders, they are the respected, they may be the influences in social media or just local influences. And those are the people we need to get to first, because they carry the communities with them. And there is, unfortunately, a lot of misinformation out there that does need to be addressed. And that's not something government and arguably senior NHS leaders can do. Certainly the NHS frontline staff are very trusted, but it's local communities who are the focus. And I think we've done the big steps. We've even done, I think, the hard yards in this. Now we're right down to individual focus, to individual people, to have them come alongside the vaccination programme. And it is critical, because we know that, you know, an older person or a vulnerable person who hasn't been vaccinated is at considerable risk.
Thanks, Keith. So go to Ruth, and then we'll, Julian, we'll come to you if we can for the financial report. So Ruth.
Thank you, David. I just want to build a little bit on what Pauline and Amanda have said, in that the pressure is absolutely in our hospitals and our community services, but also in our maternity units. I'm very grateful for the nurses and midwives across all of the sectors. I was in Liverpool, Her Majesty's Prison in Liverpool, witnessing some amazing nursing leadership, particularly what they were telling me through the first wave of this pandemic. And also, of course, those particular small services like the homeless and the inclusion nurses at Beacon House in Colchester. They've done an amazing piece of work, even though the pressures are such. I guess for me, it'll be the ways that teams have come together during this pandemic response that I will be the most proud of. And I was lucky enough to go to LAS ambulance service last week and meet the mental health nurses working with paramedics as one team, the consultant midwife working with the paramedics as one team. And it's really great to see that. So the supply of nursing is going to be important. And we're doing some great work on that, and HE is doing some amazing work with Mark Redford and team on the supply of the future nurses, and Duncan Burton and team are doing some amazing work with trusts across the country on international recruitment. But it's now how we support our nurses and NHS staff that's going to be important, as well as recognising. And my final point, I just want to congratulate, if I may, the Windrush Generation Committee and Whittington Hospital, because just earlier this month they celebrated Windrush Generation and their commitment and their contribution to the NHS. And it was a wonderful way to celebrate nurses across England.
That's very inspirational, Ruth. Thank you very much for that. On less inspirational, perhaps, moving on to the finance report from Julian. Julian.
Sorry, struggling with the technology. I won't repeat what is set out in the paper, other than to say we are living within the budget that was agreed for the first half of the year. It included £1 billion provided for elective recovery, which has largely been both drawn down and spent, and has been critical to delivering the levels of extra elective care that Amanda referred to at the very beginning of this meeting, as trusts continue to live with the sort of operational constraints and demands that have arise from COVID. Worth saying that today we have published the planning guidance for the second half of the year, following agreement of funding with government for the second half of the year. It basically allows us to maintain cash levels of funding into the NHS. It continues to provide £1 billion, another £1 billion of support for elective recovery over the second half of the year, as we seek to maintain and increase services alongside normal additional winter demands. It means we can continue with the hospital discharge programme, which has been so critical to enabling us to maintain flow through hospitals and the capacity of hospitals. It will enable us to continue the same scheme for mental health services throughout the second half of the year. It also sets out the details for how we are looking to spend £500 million of capital and around £200 million of revenue support that, again, the government have provided for the second half of the year. That will enable us to look at how we can further increase our capacity to deal with the backlog of care in the acute settings, and look at how we can invest in technology and transformation that, again, will put the NHS in a better place to both deal with driving out sustainable financial savings and improve performance as we look ahead to 22-23. Worth saying that in the plan for the second half of the year, we are asking providers to deliver a 2% efficiency saving on average as we continue to restore normal financial disciplines as we have come through COVID. So that's where we are. We're clearly still in the process of some of the spending review negotiations. In particular, that will be critical to setting the right capital budget for the NHS, and a really, really important factor that we get that right so that we can deliver the ambitions the government set out for elective care at the beginning of September.
Thanks, Julian. Well, clearly the investment in the workforce is going to be crucial to this. And I just wonder, David, Ian, given your chairmanship of HEE, how do you see that?
Thanks, David, and thanks, Julian. So I think this is a challenging time for workforce, but the good news is that I think the work that HEE is doing with NHS Improvement, NHS England, as well as the Department of Health, so sorting this on a trilateral basis is absolutely fundamental to the future. And I just pay tribute to Julian and the way that he's worked with Navina and Callum in HEE and with the department. And I think there's more work that we need to do as we go into the autumn to actually be clear that we do have sufficient to meet the baseline commitments, but also the resources there to actually make some of the transformational changes we want to make. And again, particularly important that the work that we're doing in HEE with Perena and through the people boards and the people advisory committee, which Andrew Morris co-chairs with me, are the vehicles to do this. But I think we need to be clear and honest, David, that there are some challenges when we look at the workforce going forward, and we're working through those, and we will come up with a clear plan later during October. But there are some choices to be made, and what choices mean is that will mean we'll be able to do some things and not do everything that everybody wants us to do, and that's not a great place to be. But we do need to make some decisions about priorities. But the important thing, I think, is that we're doing that collectively and collaboratively and not doing that separately and in isolation. And that's where we can ensure for the money we have got, we'll get the best value for that money, because it's an agreed set of investments that we'll make. But thanks for the opportunity just to say that.
Thanks, David. And of course, I mean, technology is going to be so important as we go forward. And I just wonder, Laura or Simon Bolton from NHS Digital, whether you'd like to comment at all.
Well, thank you, David. I would sort of echo what David Behan said in terms of the trilateral working to make sure that as we look at the next few years, we've got the right investment in tech to actually create the efficiencies and to create the changes that we're looking for. So I think we obviously will have an important request in terms of the spending review, because I think some of that is we still do need to up our level of investment in some of the underlying technology support. But I would sort of endorse what David said in terms of the way we're approaching that is hugely important. And I think the opportunity is what Amanda was articulating, which is as we seek to address the current challenges, how do we do it in ways that actually build for the future? And I think part of that is our use of digital and tech.
Thanks, Brian. It's really good to have Simon Bolton with us today. Simon being the interim chief executive of NHS Digital. Simon, did you want to comment at all?
Yeah, if I may, David, I think just to build on those comments, I've been in the role for about 4 months now, and I'm really delighted at the way that the central teams are coming together across EI, DNX, to think really deeply about what we can do to support the providers and the ICSs to really make a difference with digital technology, because of course this has to be a partnership, making sure that we prioritise the things that are most important to the service and work together to deliver those. So it's really delightful to see that those teams coming together. So I think that's all I'd add at this stage. Plenty of work to do though.
Okay, thanks, Simon. And Julian, just on behalf of us all, a huge thank you to you and your team for spending the whole of your summer holidays working on the financial settlement that we've got. And we hope that you'll get a good settlement on October the 27th, because capital and of course workforce are both hugely important. So Julian, thank you very much. So shall we move on then to the next item, which is delivering net zero NHS? Can I see Nick Watts on the call? Nick,
I'm here. Hi, David.
There you are, Nick. Nick, well, look, I think maybe Ian, you'd like to introduce Nick, but I'll just say that I've been working with Nick closely for the last year or so, and you've done a phenomenal job in really putting this at the top, when it's one of our top priorities in the NHS. But Ian, do you just want to kick it off?
You've given a perfect intro to Nick, so straight over to Nick.
All right, thank you. Listen, the entirety of everything that we have achieved over the last 12 months, that's outlined in the paper, except that it's not, right? Except that to try to capture the energy, everything that is happening across the NHS to respond to climate change, not possible in just a paper, not possible in just a 25-minute board item. Nonetheless, 1 year ago, almost to the day, the NHS became the world's first healthcare system to commit to net zero emissions. The words I think I've most frequently heard used to describe that strategy that came out alongside it is a combination of, wow, that's ambitious, and also it's evidence-based, it's feasible. Right, ambitious but feasible, which I think is precisely the balance there that we were trying to strike. It came together as a result of an expert panel which brought together health professionals, climatologists, engineers from across the country, the very best we have, but also a public consultation and a consultation with our staff. And I remind everyone I speak to, every single time you go out and you ask our 1.4 million staff, and we did this just a month ago, where do you want to see us invest our time, invest our attention? 9 out of 10 of them, and this is despite everything that's happened across the world over the last 12 months, 9 out of 10 shout back. We want to see the NHS, we want to work with the NHS as we deliver a response to climate change. So 2040 for our direct emissions was our target, 2045 for the entire footprint, including our supply chain. To put that in context, that's 1,260 kilotons of carbon we were aiming to reduce over the last 12 months. Amanda, you put that in even better context, 1.1 million homes, the equivalent of powering 1.1 million homes across the country, 1.7 million flights from London to New York and back. It's been 12 months and there's been a lot that's happened in our estate. Simon Corbyn and his team working to deliver investments of over £310 million across 94 trusts, smarter, more efficient estates. A lot of what you want to do to respond to climate change, it has some of the best returns on investment you will see, paying back in 2 to 3 years, because it's all about increasing efficiency. This comes and accompanies a new net zero hospital standard, but it also looks like real things happening on the ground. 2,500 solar panels on the roof of Milton Keynes Hospital, modern heat pumps at Gloucestershire Hospital, saving money that can then be reinvested back into the system. With James Cook and his team leading a lot of our work on travel and transport, we have agreed at the last board meeting a trajectory to net zero our non-emergency patient transport. Already we have seen parts of the system respond. South Central Ambulance Service starting to purchase zero emission rapid response vehicles. Oxford University Hospital using electric bikes for couriers to deliver cancer treatment across communities that they serve. The world's first, I think, just recently, quite large 18-ton truck, electric trucks used to move goods around around the service for the Northern Care Alliance. And if we can keep quiet about it on this public board, sometime in a couple of weeks, we hope to be able to be in a position to talk about the world's first electric ambulances that are able to supply both our urban and our rural populations. In the world of medicines, 25% of our emissions pharmaceuticals make up. Blake Dark, I'm sure here somewhere on this call, Claire Foreman have been leading much of that work. It takes the form of the National Overprescribing Review, demonstrating the one-in-one, hand-in-hand alignment of net zero in response to climate change and better patient care. We set targets for a 10% use of desflurane, a particularly highly polluting anesthetic gas. 10% is what we wanted to hit. We blew past that, and trusts are now going further and faster. In fact, I was on calls just the other day. People weren't talking about 10% or 5%. They wanted to eliminate it altogether, and they think they can do that while improving care for their patients. We've also seen, and so it was 12 months ago, we released our own net zero strategy. Despite everything that's been happening, 155 trusts across the country have almost completed their own localized, internalized net zero strategy. Every trust, by the end of the financial year, we're going to have with their own local strategy, a green plan. And that's where I think we need the help of this board to make sure that that message is clear, that those net zero strategies are built into our integrated care systems as they come to life, built into the work that our trusts are doing as they recover and respond to COVID. All of those things together, estates, medicines, the way that we deliver our care, the way that we move our patients and work with our patients across the country, puts us on track to deliver the reductions that we were talking about, 1,260 kilotons of carbon 12 months on. It's unprecedented to have the NHS be the world's first healthcare system to commit. It's even more impressive to be able to say that we were able to deliver against that 1 year on. That's the first half of that paper, but there's something equally as important, and it's the work that Priya Bailey and her team have been doing. She's the author of the second half of this paper, but not here today with us. Within the decade, the NHS will no longer purchase from anyone who doesn't meet or exceed our commitments on net zero. This is the words from our net zero strategy 12 months ago. Now, we knew that we needed to go away and we needed to work with suppliers to make sure that we were developing a pipeline and a pathway to net zero that worked both for the NHS and for the industry. Priya and her team, they've consulted extensively. They've started innovation competitions to broaden the pipeline, and the response that has come back is absolutely, we are there with you. David, you've been leading an international leadership group. Since we started this journey already, Johnson & Johnson, Smith & Nephew, GSK, AstraZeneca, Elise, some of our largest suppliers have come online and said, absolutely, we want to work with the NHS to get to net zero. And so the paper takes this journey one step further. From April 2022, we're proposing 10% of all procurement decisions start to consider a net zero weighting, and indeed we launch a new sustainable supplier framework to work with our 80,000 suppliers on this journey. April 2023, all contracts over £5 million start to demonstrate their alignment with our ambitions for the direct emissions. And April 2027, all contracts, full stop, across all scopes, starting to develop and demonstrate their alignment with our ambitions. And that is how, for our direct emissions and for our entire footprint, we get to net zero by 2040 and 2045. So listen, I'll stop there. There is so much more that I could say. There is so much to be proud of. So much that has happened while there has been so much else going on across the country. It is so exciting to be able to demonstrate not only is delivering a net zero healthcare system possible, but it's exciting. It's good for staff. It's good for our patients, and with your support, it's inevitable. Thank you.
Nick, thank you very much for that. Looking at Mike Coop, I know has a keen interest in sustainability, and what are your reflections on the programme that's just been outlined?
Well, first of all, it's the excitement is very palpable, and to the point that's already been made, not only is it a societal expectation, it's also an expectation of our employees and indeed our future employees. So it's absolutely fantastic, the work that we're doing. I don't underestimate the challenge. I suspect we probably know half the answers to the questions, but to your point about ambition, we probably don't know the other half of the questions that we need to answer over the period of time that we're undertaking the work. But I think what you're doing is absolutely amazing and clearly front and centre of the world's biggest challenge as we look forward. So it goes way beyond the sort of most immediate time horizons that we tend to talk about. So congratulations, and I think you bring a lot of energy to the work, and it's great to see the organisation working the way that it is.
Thanks, Mike. I wonder, Nick, whether you could just give a few reflections on COP26, which is now, what, only 6 weeks away or something, or even less.
Close, terrifyingly close. COP26, 5 years on, it marks from the world coming together to sign the Paris Agreement, a global agreement to limit temperature rise to well below 2 degrees, 1.5 degrees, roughly where science thinks the safe threshold is. It's in about 4 weeks. It's important to the NHS, I think, for a couple of reasons. We made our commitment 12 months ago. Since then, we have been joined by our friends across the world. President Biden announced only a couple of weeks ago the formation of a new climate change and health equity unit, a department within HHS, looking to build off the foundations that the NHS has developed. In Germany, there's a new department springing into life within the Federal Ministry of Health, focused on the response to climate change, both mitigation and adaptation. I think now in 6 out of 6 states in Australia, they have their own equivalents working on this as well, coming online in Western Australia, New South Wales, Queensland. The reason I mention all of this, David, is this is the moment where the world comes together to make some of these joint commitments, and it's quite exciting for us because we are seeing increasingly that healthcare systems all around the world are starting to follow the leadership from the NHS and indeed are forging their own paths. I say again and again, the NHS can't get to net zero unless we all go there together. All 1.4 million of our staff, all of our suppliers, all 80,000 of them, and healthcare systems that we are intertwined with across the world. The reason COP is so important, the UN Climate Change Summit, is because it's the moment where we reaffirm and we demonstrate again and again that actually we're not alone. Actually, everyone is moving this way with us because the evidence is pretty clear. The response to climate change is good for health. It is good for our patients. It is good for the NHS.
And I should add, Laura, that this is just another example where digital health, virtual health, can make a huge contribution. I think I'm right in saying, Nick, that something like 20% of all traffic journeys at rush hour in Birmingham are health related. You know, if we can just get cars off the road, it will make a huge difference. And I'm wondering, Wal, in your world that you're in, is climate change, sustainability becoming, you know, something that you take, you know, a lot more seriously today than you would have done a few years ago?
Definitely, David. I mean, for a number of reasons, not least because obviously we, in my day job, we invest money on behalf of pension funds and insurance companies and endowments across the world, and they have been some of the leading players in you know, pushing companies to sort of adopt targets that make sense, pushing governments to adopt targets that make sense. And so we've responded ourselves by saying, well, you know, we have ourselves to be really clear about the journey we're on in terms of ESG. And I think that's probably the biggest point I'd make, which is it's a journey, not a destination. So whilst, you know, we're aiming as a world for 2% less, 2% less in terms of the degree of the heating of the world, actually that in itself will not be the end. We still need to continue. And the innovation we're seeing from some companies across the spectrum to deal with the issues that come out are quite incredible. And I think that's probably one of the things that excites me most. It's that you can both address the issue and still get innovation and still get growth without necessarily damaging the planet.
Thanks, Well, Nick, I've really enjoyed working with you for the last year. You've really moved the whole thing forward a huge way. You've got complete support from everyone in the NHS, and I think actually having the NHS sort of brand, if you like, associated with this is changing the behaviour of many of our, well, certainly many of our suppliers. I mean, it's quite interesting as well, isn't it, that the people who are really ahead of this are some of the big American tech companies. I mean, I'm particularly, you know, if you take companies like Apple and Microsoft, this is absolutely, I mean, Microsoft are going to recover, not just stop, not just get to net zero, but are going to recover all the carbon they've ever emitted since they became a company, what, 15 years ago or something. I mean, it is becoming mainstream for big corporations. So, Nick, have you got anything you want to just finish up with, or?
No, all I was going to say was I agree with you, obviously. What is really exciting is it extends beyond just those big corporations, right? You see small, medium-sized enterprises across the country, urban centres in England, rural populations across Australia, identifying that the future is a sustainable future, and that's where we're all heading towards, right? There's a direction of travel, and that is set and fixed. No one's questioning that anymore. The question is, are you ready to respond to that? Are you ready to lead that journey? I'm really proud to be a part of the NHS as we do that for healthcare. I'm really excited about where we're gonna end up with this.
Good. So, Nick, next time we'll see you, you'll be driving that electric and hydrogen ambulance up in Glasgow, I guess.
That sounds dangerous, but I might leave that to you if that's okay.
Okay. Well, thank you very much indeed. Thank you.
Thank you.
Right. Well, we're moving on then to the next item, which is freedom to speak up. I'm not sure whether Anne Rabmore has joined us quite yet. So, Andrew Morris, can I invite you to introduce our two colleagues, our two freedom to speak up colleagues who are on the call, and sort of hold the fort until Anne gets here.
I think that David, actually, I was going to introduce the item after Andrew until Anne gets here. But Andrew, why don't you go first?
No, you go ahead then, Steve. Go on.
Well, I think we were going to. I was going to say a little bit on my 2 years worth of being executive lead for the internal freedom to speak up function, and then bring in Nick and Gary, two of our guardians who are here today, to give their reflections, and then hand over to Anne. But Andrew, I'm sure there'll be an opportunity for you to come in as the board sponsor as well. As I've just said, I took over the role of executive lead for Freedom to Speak Up just over 2 years ago, and it's been a real privilege to do that. I do hope that I know that we have made some progress during the 2 years, so some of that is in the paper, but I'd reflect on bringing the Freedom to Speak Up guardians and processes from NHS England, NHS Improvement together into a much more harmonised set of guardians and a harmonised set of processes, which we have also strengthened to support the guardians. We've increased the number of guardians that we have to ensure that they are spread widely across our organisation, which of course is both geographically spread and spread in terms of individual directorates. And we've also ensured that the guardians reflect the diversity that we have in or reflects the diversity that we have in all the staff at NHS England. So I think we've made some real progress, but there is undoubtedly much more work to do, and we'll talk a little bit about next steps when she comes on. But just a few final thoughts from me. So first, I'd like to say we're really fortunate. I've met with the guardians regularly over the last 2 years, but we're really fortunate that we have such passionate and committed Freedom to Speak Up guardians who are there to support our staff and also to challenge us back as senior leaders. That's an extremely important function of the guardian role. It's vital that we support managers to listen up, as well as empowering staff to speak up. So this is not just about speaking up, it's about listening as well, and we all have a responsibility there. And I know executive directors are meeting with their guardians, are supporting their guardians, but I think it is really important that the executive team, the senior leadership team, continue to do that within their directorates. All directorates have their own guardians, and so meeting with guardians on a regular basis, as well as empowering staff to speak up, I think is really important. And the last reflection I wanted to have was to pay tribute to Henrietta Hughes, who has stepped down recently after a 5-year tenure as National Guardian. Henrietta has attended this board on a number of occasions when we've talked about freedom to speak up, and she has been a real support to me personally, and I think to our organisation as we have progressed this agenda. She has helped us where we need help. She's challenged us appropriately where we need challenging, and she's really said to us, you need to be as good as the best trusts out there, the best organisations in the NHS at freedom to speak up. And she's helped us with some of the particular unique challenges that we have around the geographical dispersion of our staff, for instance. So those are my reflections, but I think now I want to bring in Nick and Gary. I don't know who's going first, but I'm sure you have decided between you, two of our guardians, to give their reflections on the report and on the last year.
Thank you very much, Stephen. I will go first. My name is Nick Hodgetts, and I'm one of the Freedom to Speak Up Guardians, as Stephen has said. Gary and myself have both been Freedom to Speak Up Guardians for some time now, to the point I think we're regarded as kind of senior guardians within the team. So that's probably part of the reason why we're here. We also have each other's notes so that if either of our technologies fall over, the other one can dive in quite quickly. So hopefully we're as prepared as we can be. But thanks ever so much for the opportunity to enable us to speak at this meeting. As Stephen has said, it has been a thrilling year in terms of the progress of the Freedom to Speak Up movement and everything that we have done. Just as some reflections of, from our point of view, it's been really good that things have risen so significantly in the last year. I think Gary will probably attest as well that in the first 12 months, it was quite early days. I think although the Freedom to Speak Up Guardians came in first in about 2015-16 time, the system was still more or less in its infancy in terms of what it was starting to deliver. But in the last 18-12 months in particular, the amount of support for Freedom to Speak Up, both from the organisation and in terms of the success it is achieving, has risen significantly. I don't want to kind of re-emphasise things that are already in the report, but it's great that we've been able to increase, for example, from 17 Freedom to Speak Up Guardians up to 42 in the last 12 months. And as National Freedom to Speak Up Month comes around again in October, we'll be recruiting more numbers to that list, and already we're at the point where we need more people than we currently have. But it's also enabled us, as well as resolving some of our caseload, it's also allowed us to do a lot more proactive work promoting Freedom to Speak Up across the organisation, across our directorates and our regions, and allowed each of the guardians to actually have an active role, not only in caseload work, but in speaking to our senior managers and our senior leaders and improving the profile of what we do. We've also gained a grip on the reporting process, which is never as kind of sexy as hearing about the impact, but again, it's helped us to get a real grip. We are now able to not only log our casework more effectively, we are also logging our promotion work, and just seeing the quantity of it as we kind of input it onto the system, we are clearly doing a lot and getting out there a lot. And more than that, people are plucking up the courage to speak up in more numbers than there were previously. I think as well as that, there has been an increase in the number of people who have reported to us on an anonymous basis, which kind of sits one or two ways depending on how you look at it. I think it's partly a positive reflection because more people are plucking up the courage to speak up. It might be that at this stage they only feel they're able to kind of speak up but may not feel safe identifying themselves. But I think the fact that more people are speaking up is a good thing. It does, of course, present the challenge that it would be great in the ideal world if people feel safe enough to speak up. and know that they can do that whilst identifying themselves and knowing that we can take those things towards a successful conclusion without kind of the fear of negative repercussions. That would be the ideal, but it's a challenge that we are continuing to work on. And I think as well, and this was a very significant meeting that we had, one of the meetings we had last week with our non-executive directors, some of whom were on this call. We do have a lot more regular support and interaction, both as a team and also with the executive leadership and the non-executive directors for Freedom to Speak Up. And even they were saying to us last week that even though some of the conversations we have are difficult, and even though some of the cases we end up getting involved in, which might involve kind of senior levels, might meet with difficult conversations, on occasions resistance, the fact that the conversations are happening in the first place is seen as a major step forward, and is seen as a positive that culture change is starting to happen. It might be happening at a fairly slow pace. It might take a long time to fully kind of transform things into the way that people would ideally like them to be. But getting that endorsement from the people at senior level, for which we're hugely grateful, getting that sense that a real difference is being made, not just in terms of resolving people's individual cases, is, I think, a massive endorsement of Freedom to Speak Up and a massive step forward. And the final thing I will say before I hand over to Gary is that another major issue that's come up, a positive issue that's come up in the last few months, there's a brief mention to it in the report, but I wanted to kind of mention it because I think it's important. The links of Freedom to Speak Up into the wider work that supports the overall people plan. We are starting to regularly get approached to become involved in bullying and harassment, involved in Directorate OD work, into EDI, into civility. Freedom to Speak Up isn't just making a difference in its own silo, if you like. It's hugely successful there, but it's also becoming a key part of the overall people plan and supporting 7 ways of working across the organisation. And that, I think, is a massive thing, because it means Freedom to Speak Up isn't just about freedom to speak up with those capital letters. It's freedom to speak up as a concept, a wider concept, linking that into the strategic work that we're doing. There will be people who are speaking up who may not come via the formal process, but just come to us informally, or start to speak to colleagues elsewhere in the organisation that may not be guardians. But it's starting to happen. It's getting out there. The increased number of formal cases is going up, but the amount of additional work and the strategic links on top of that, I think, are even bigger success stories. So we're hugely grateful for all of your support, and hopefully continue to count on it. And I will hand over to my colleague, Gary. Thank you very much.
Thanks, Nick, and hello, everyone. I just wanted to quickly just give out 3 top priorities for improving speaking up culture. As Steve mentioned, we think it's very important that there's visible support from the executive. So to normalise speaking up, we think is essential we continue to receive the visible support from our executive directors to bring about this cultural change whereby staff at all grades can feel confident that they won't suffer detriments if they do speak up. So executive directors have committed to participate in Speak Up Month, which is in October, by hosting webinars for their teams and making individual pledges to address perceived barriers. But we would like this to continue once Speak Up Month is over. Secondly, there's the issue of leadership development. So the November 2020 staff survey indicated that the continued people interventions and leadership efforts had had a positive impact. However, there's still room for improvement, particularly regarding equality and diversity and inclusion, bullying and harassment, immediate managers and health and well-being. Some staff report that they lack clear objectives and report feeling undervalued by their line managers. Individuals can be used to giving or receiving feedback, and success at work is often not celebrated. In addition, some perceive that the organisation is not always equitable in its approach to equality, diversity and inclusion. So we think leadership development should focus upon training all staff to work together, to set clear goals and priorities, to receive feedback and listen to those who are speaking up. And finally, there's the issue of tackling the barriers to speaking up. The Advocacy and Learning team recently completed a research project into barriers that prevent speaking up. We'd like to see the lessons learned from this research implemented to encourage more people to speak up when they have concerns. Various identified included a previous poor experience of speaking up, feeling it's not worthwhile, a perception that senior leaders aren't interested, and the fear of repercussions. And these barriers need to be removed to achieve a true speak up culture. Thanks very much.
Thanks very much, Gary. I see that Anne, you've joined us. In case people everyone doesn't know, Anne is our regional director for the East of England, and been with the NHS for a long, long time, haven't you, Anne? And but would you like?
Thank you for that, David.
Would you like? I mean, you sort of come in at the end of things rather than at the beginning. It was unfortunate we were running a little ahead of time, but like to give us your reflections on the Speaking Up programme.
Yes, thanks very much, David. And I did manage to catch most of Nick and Gary's contribution, and I'm sure Steve was giving his reflections on a busy couple of years. So I hope you feel that the report in front of the board today reflects that there's been real progress made. And I think to Nick's point, freedom to speak up is stepping into that space where more broadly it's about creating an open culture. But there still remains a lot to do. And I suspect it might be one of those topics where there will always be more to do, actually, and the board might want to think about that further. So the direction the board set some time ago has clearly been followed, and we can see a tangible network of people and processes that now exist and are delivering the benefits my colleagues were describing. The numbers reporting do remain low, although they have increased. And further reporting and speaking up, and particularly, as Nick was saying, moving to being confident to do that with the name attached, I think is a thing we have to aspire to over the next year. And the broader work that was begun in 2020 during the height of the pandemic on our 7 behaviours and the culture work that Praina's been leading has created that context and the drive for the work, and there will continue to be real resonance and benefit between both. There are a number of recommendations in the paper that you have seen, and I'll be working with our guardians to build those into a programme of work for the next year, so we're clear about how the things we aspire to do can be delivered. And you've just heard from Gary, the priorities that come directly from our guardians, where we should put our time. And I think they resonate strongly with my personal reflection coming into the SRO role here. For me, the 2 most impactful changes are going to be shifting the culture and increasing that senior leadership. And we are absolutely seeing that. Gary mentioned Freedom to Speak Up Month and my NHS executive colleagues taking an active lead in that period. But also the discussions that my executive director colleagues have now committed to have with their own guardians, with their directorates on a quarterly basis, reflecting both on individual cases, but also on process and openness. And also the use of data that we're now sharing regularly with executive leads so that they can see the level of activity within their own directorate. I think the second area for me is absolutely what Gary was recommending to you, which is the ability to give and receive and hear feedback throughout the organisation. And that again is a piece of work that Praina has led and developing that capability, and it's something we clearly need to work at further, but I think we've started to step into that space. So I'd welcome any reflections, David, that the board might have as we shape next year's work. We need to continue, I believe, to be guided by what we hear from staff, what we hear from our increasingly skilled group of guardians, and the development approach that Praina and the HR and OD team are developing, and the emerging evidence, I think, of how all that is coming together to increase the quality and culture of our own organisation. And as part of that embedding, I'm delighted to say that Sir Andrew, as the non-executive lead, and I will be meeting with our new chief exec to review the Freedom to Speak Up work programme at the beginning of November. And I think that gives us a real anchor point to set that programme for the year to come.
And thank you very much for that and for your leadership in this area. It's been invaluable. So we're going to come to Wal and Laura, and then let Andrew and maybe Praina have a last word on this. So Wal.
Thanks, David. I do agree with your comments around Henrietta and her leadership. You know, it was very valuable, and I still see her actually because we're together on another board, which is great, and she's being equally challenging there. And that takes me to the question. So one of the things which I think we invited Henrietta to do was to look to the next mountain, and to challenge us as a board to look to that. And so I'd ask the question: what else can we be doing? What else is this stretch target above and beyond all this? And the second question is, on this journey towards improving culture, which is what this is all about, kind of where are we on a scale of 1 to 10?
Anne, why not pick those two questions up now? Prana might want to try and answer the second question at the end as well, but Anne, over to you first.
Thank you. And I mean, I have a personal view, but I think probably the second one is Prana's to respond more generally. I think the stretch target would be to move to some kind of adult to adult relationship where we can discuss difficult issues. And I think I could take you to places in our many thousands of staff where that's happening, and we've got that in reality. I could equally take you to places where it clearly isn't. And so I think if we go outside our current construct, outside our organisation, what you read about and hear about is it's that adult to adult relationship that fundamentally makes a difference. And if I think to my time when I was leading NHS organisations, where they really hummed and worked for the benefit of patients and were a great place to work, we'd got that right balance. So that for me would be the stretch target. I'm sure your follow-on question will be, Anne, how do we get there? I might need a bit longer to reflect on that, well, if that's okay.
Thanks, Anne. Laura?
Yes, before Prana kind of probably picks up both of the questions. Henrietta's impact looms large, because I was actually going to sort of reflect on something that I feel I heard from her, which was almost thinking of this as a three-part journey, the sort of speak up, listen up and act up. I can't remember if I've got that last one right, but the sense of, it feels like we've made a lot of progress with the speak up. I think quite a lot of what I think I'm hearing from the Guardians is actually how do we embed more in our leadership approach around listening up, and then probably the same through to act up. So I guess that would be my challenge, is that how do we increasingly frame this in those three ways? Because I think that very much shows what everyone's part is.
And do you want to respond to that?
It's certainly a construct that I have explored as I've come into this role, Laura. I would absolutely agree. And I think that if taken together, they are an articulation of that adult to adult relationship I was just talking about. I am going to defer to Prana, because I'm very clear that I want to nest this piece of work within our broader cultural piece. So I think I'll defer to Prana, David.
All right, thank you, Anne. Andrew.
So I think if you work on the principle that everyone has a voice and a right to be heard, we've moved mountains. We've really made some good progress. I think we are listening, but we don't always act, to pick up on Laura's point. And it's the middle tier of the organisation that's probably the weakest link. And I know Prana's on the case, but we need to support managers on how to engage and how to listen and act and do this in a positive way. And it's part of our cultural change in terms of becoming a more open kind of organisation going forward. So when I compare it with where we were 3 years ago, boy, have we moved on. It's, you know, really refreshing to see the progress and, as importantly, the enthusiasm from our Guardians, because they are fantastic. They're people we should treasure. They're really good barometers of, you know, what the organisation feels and thinks at any given point in time. So I think we've made some really good progress, but we haven't quite mastered the acting bit, and I think there's more work to be done. But there's exec team support for this, so hopefully, you know, we will see it cascade down through the structure over a period of time. So I'm really cheered by the progress that we've made so far. It's been quite a fantastic journey to be part of. So thank you.
Thanks, Andrew. Prana, last word from you. And maybe you could pick up Wal's second question about where we are on the journey.
Absolutely. Thank you so much. And it's great. It's been great to work very closely with Steve and also now with Anne on this very important element. So as Andrew and others have said, actually, I Have a Voice is a key part of the People Promise, which is part of the People Plan. And I have a voice that counts in shaping my work. I should have a voice that counts in shaping my contribution, in creating improvement, in creating positive change. And what we are doing is making sure that we are gathering evidence about how the changes are impacting people's work life and their delivery. So we have, for the last 15 months, been doing monthly check-in surveys. As soon as the pandemic started, we started a monthly staff survey, which tells us in real time where people are and where managers need to focus and teams need to focus. Our annual staff survey, of course, showed us actually that we've made progress in a number of areas, including listening and two-way communication between managers, leaders, and their teams, and also identified some areas of focus, including line manager skills. So we have invested in training for managers, especially virtual management. How do you lead virtually? How do you manage a team virtually? Leadership development, and also looking at how we have much more of an improvement mindset as as across the health service. That's something that we want to enhance. And the closer we can get to the service, the closer we can get to patients, the more open the culture will be. Because ultimately, if someone is giving ideas and suggestions about how we are going to enhance our delivery and our service, I mean, we absolutely have to be welcoming that. And that's why we all, we're all at work. It doesn't always happen like that, as Anne was saying, and as our Freedom to Speak Up Guardians have shared as well. So we have a people plan for NHS EI, and we measure progress on it through our staff surveys, which are now, we're going to move to quarterly so that we have some time to make adjustments, and the rest of the NHS is moving to a quarterly survey as well. We are able to get down to a team level when we look at those scores, and so again, we can make much more targeted interventions in terms of supporting managers and supporting teams in order to do that. So evidence-based, on taking the people promise and focused on our delivery for the service. Thank you, David.
Raina, you deliberately not answered Wald's question, I think.
Which is, how far are we on the journey?
Yeah, how far along are we? Maybe it's a fair question.
No, well, I think it would have to be, and which is why I went to the staff survey, because I think what I would want to know is where does the majority of the staff think we are on the journey? And they're saying that I get, they're much more engaged with leaders and with managers. Overall engagement has gone up. Advocacy about would I recommend this as a place to work, NHS EI, went up by double percentage points during the pandemic, actually. But in areas where they said line managers need more support and need to have stronger skills in order to, in order to create a better environment, there are areas that we haven't progressed as much as we would like.
And that, of course, applies, from the feedback we have on the workforce race equality standard. We've got a lot more work to do, haven't we? Anyway, thank you very much for that, Prerna. But and Anne, thank you very much for joining us. And Gary and Nick, thank you both, very much for taking the time out to be with us today. The work you're doing is incredibly important as we try and change the whole culture within which we're working in the NHS. So thank you, all three of you, very much indeed.
Thanks ever so much, everybody.
Thank you. So just two things, I think, for noting. This item 6, the mandate. Ian, you don't want to talk about that, presumably. We're just noting that, I think. And the complaints policy we are noting as well. Just before we get to it. Oh, Ian, your hand is up, is it?
I just wanted to say very briefly that the mandate is obviously a really important part of the formal accountability of NHS England as a statutory arm's length body of government to government. And this paper kind of briefly lifts the lid on the government's assessment of how we performed during 2020 to 21. And I think it both reflects the intrinsic difficulty of some of the challenges in relation to elective recovery, urgent and emergency care and dental activity, but also the huge achievements by our own staff and NHS staff in responding to the pandemic. Thank you.
Thanks, Ian. if there's no other business, I'd just like to say one thing. This is Dido's last board meeting. Actually, Dido was on my interview panel when they made the terribly mistaken decision to make me the chairman of NHS England. But I've just been noting as we had the discussion today that the people plan must have been mentioned 25, 30 times. You know, it's become an integral part of the way that the culture is changing within the NHS, Dido, and you were the principal architect, along with Julian Hartley, I think, at the time, of the People's Plan, and you've made a huge contribution to the NHS. If I had to pick one word, Dido, and limited myself to one word to describe you, it would be courage. I think the way that what you've been through and the way you picked yourself up and come up smiling, bearing no grudges, is a huge testament to you and a huge example to all of us. So on behalf of everybody on the board, I'm sure, and through your many friends in the NHS, Dido, a very, very big thank you.
David, thank you so very much for that. And it's been a privilege to work alongside you and everyone on the board, and even more so a privilege to be part of the NHS family. So thank you all very much, and I hope we all stay close. I think the meeting today, although it's incredibly challenging times, it's both heartening and I think really encouraging to see the agenda that Amanda and the team are setting out, and I'm sure we will all benefit from their endeavours going forward. So thank you.
I think the meeting has been drawn to a close. Silently.
The way that only David can.
Thanks all. Bye.
Bye.
Thank you.